Welcome back to HealthWise. With us is my special guest, Dr. George Ray Williams, a spinal surgeon at Opelousas General Healthcare Systems. Doc, I want to also say before we get started also that Dr. Williams is located on the second floor of Opelousas General Medical Plaza.
Yes, sir.
The North Campus, right off, I think it's Attakapaw. Is it the street?
It's actually Wayne Gilmore Circle.
Wayne Gilmore Circle, okay. All right. And beautiful office on the second floor. So I've been there numerous times with patients, and I was really impressed. Doc, let's get back to what we were talking about, the back pain. What can be done about back pain? I mean,
yeah, that's a great question. I tell you, when it comes to back pain, 80% of the population at some point in time in their life will get an episode of back pain. The good thing is, of those, 92% will resolve in 6 weeks on their own. If you do get an acute onset of back pain, what you want to do is just kind of take it easy, a rest for 2 days, take some anti-inflammatory medicines. You can alternate ice and heat packs, that kind of thing. After that, you want to try to start moving, because studies have shown that people that actually become inactive, that actually has a deleterious effect on back pain. It can cause weakening of your muscles, deconditioning, etc. If your back pain doesn't resolve over a few days, you may want to consider calling your caregiver to evaluate it. Certain red flags for back pain that should be seen sooner rather than later. If you have back pain with leg pain or arm pain, any weakness, difficulty using the restroom, night sweats, weight loss, fever, chills, those are conditions that need red flags and that need to be seen sooner rather than later. But usually most people get out in the yard, maybe exercise for the first time, usually that's the first type we talked about. They usually will resolve in a few days. Okay.
And how important is, you always see these commercials and they always tell you how important it is to have a proper bed. Is that real important, you know?
It's a factor, it's not the factor. Any type of, obviously none of us are going to sleep on a board like my mother used to do. But what you want to do is you want to have a good firm mattress. But the bottom line needs to be comfortable, because anything that's not comfortable is not going to be any use to you. Right. But firm but comfortable is the main thing. But some people advertise, and I'm sure there are some studies, but there's no really definitive science that shows that one mattress is better than another. But the bottom line is I would go with a mattress that's firm but still comfortable.
Sure, because that's always been a thing. You know, some people, the old train of thought was, man, you got to have a firm mattress. You got to be a firm mattress, you know what I mean? But we don't want it uncomfortable. But then I know for myself, one time I bought a really soft mattress and I started getting back pain. So when I switched to a firmer mattress, then I knew that, that I didn't have any more back pain. So.
Oh, sure. No, like I said, firm is good, but comfortable is the main thing.
Sure. What about posture? Even in sitting and proper posture, does that have an effect on?
It has good posture is good to have, but usually good posture coincides with conditioning and being in shape. And I tell you, exercise, being in shape is categorically the single most important thing a human being can do, not only to prevention, but also fighting either reoccurrences of spinal afflictions, neck pain and back pain.
Well, I know myself, I had gotten a spinal injury when I was younger and fell 20 feet head first and probably should have broken my neck, but because I was in probably the best physical shape of my life at that time, I was able to, my muscle strength in my neck kept me from basically breaking my neck.
Oh, sure. No, the old saying, an ounce of prevention is worth a pound of cure, certainly plays the same status in the spine.
Sure. Next question is why, I've always wondered about this. You wake up with a bad neck, a crick in your neck, they call that a crick in your neck. And they always say, well, that's because I slept bad. What is that, and why do you get that?
Yeah, no, usually a crick in the neck is usually to a continued muscle contraction in the neck from either poor posture, sleeping the wrong way, etc. It can be some other things too, like even upper respiratory tract infection can cause it. But typically when the inflammation resolves, that's whenever you're able to move your neck more, and it should resolve. But again, if it doesn't resolve within 48 hours, it probably should be looked at.
Okay. So that's something, because especially you hear among the elderly, you know, they always say, "Oh, child, you had a crook in your neck," and you know, and that's because I even heard some say because you were dreaming when you slept about this and that. But that was a good, you know, I mean, that answered that question for me. One other thing I think the audience would like to know is basically, I don't know if we had your phone number up there, but if they needed to contact you and wanted to come to your office, would they have to get a doctor to refer them to you, or, you know, if they thought they had something, would it be okay? Would they call you?
No, we either take referrals, or we're happy to take individuals themselves. So you're happy to call the office at 948-8556. Okay. We accept, you know, we're happy to see anybody, anytime, and please call if you have any trouble, questions, or comments. Okay.
Well, Doc, you know, like I said, we got a few more minutes. Anything else you want to tell the audience? You know, well, we got actually a minute or so to go. Anything you want to tell them about your practice and your staff or whatever? Wow.
Oh, sure. At the office, our main course of treatment is spinal afflictions, both cervical, thoracic, and lumbar. We're happy to see all individuals, so if you ever have any problems, questions, please give us a call, because that's our main, actually our only status and focus is spinal afflictions.
Okay. All right, Doc. Well, it was a pleasure having you on HealthWise, and hope it's not the last time.
Oh, sure.
And once again, Dr. George Ray Williams, up-and-coming rising star, or I should say not up-and-coming, because he's already there as a star in spinal care surgery at the Opelousas General Hospital. So, Doc, thank you.
No, thank you.
And we'll see you next week on HealthWise.
Yes, sir.
HealthWise is brought to you in part by Opelousas General Health System.